everyone. Welcome to Care Lab.
Welcome to Care Lab. We're feeling real good because we got Maria here. And we love, first of all, we love an all OT show. Second of all, we love to have Maria here. So, and third of all, we're excited to be together. So, welcome, Maria.
Thank you so much. I'm so happy to be back. You guys are the best. I love talking with you, especially about caregiver things and all of the OT things, especially toileting. So yeah, I am down to clown Charlie Brown.
So this is funny. I was in like an all-day in-person meeting with my new co-founder at Senior AI this week, and he was talking about like how all of a sudden he's like becoming immersed in like the older adult and senior care world. He's, consuming all this information. He's like, I've never seen so much about incontinence. And I was like, I tell you what,
this is where we roll right here.
Yeah. Listen, this is where the rubber meets the road, my friend. Let's talk about incontinence. And he was like, I didn't mean I wanted to talk about it right now. And I was like, but we could.
And we're going to talk about it a lot. So get used to it.
Yeah. So get used to it.
That's why Maria, awesome. Toilet Talk is such like a good name. Like when you first came out with that, I was like, oh yeah, this is totally OT. This is what we do all the time. Toilet Talk. Exactly.
Yes.
Yeah, absolutely. Oh, I wanted... yes, but I wanted to say, Amelia, because now I'm seeing you in person. Congratulations on Senior AI! Like,
oh,
heck yes!
Thank you.
That is so wonderful. I know I commented on it yesterday on LinkedIn, but I'm like, here's my chance to say, like, congratulations for being like official, out in the open, like, very exciting.
Yeah, LinkedIn official. It's a thing.
Yeah.
Yeah. I mean, I guess so. It is now.
Yes, we made it a thing. We're reclaiming Facebook official and moving over to LinkedIn. This just only describes how old we are.
That's true.
It's 1,000% true. Yeah. But yeah, the toileting all the time, everywhere. I had put a poll on LinkedIn and talking about falls in the bathroom. Because, that's a big deal. And I was just just curious, like, how many times do OTs talk about, like, falls in the bathroom in, like, do they do it daily, weekly, monthly, or never? And the majority of the answers were never.
What?
Yes.
Wait, was this a poll of OTs?
It was a poll I put on my LinkedIn, and there are a lot of OT followers. So I don't know if, like, I don't think that I addressed the question specifically towards like occupational therapy practitioners. And so for those that answered, a majority never talk about falls in the bathroom or like the cost of it. No, the cost of it. I'm so sorry. Specifically, what is the cost? Sorry, I said everybody. I'm sure there's OTs like talking about toileting.
If you're listening to this and not watching, the looks on Brandy and I's, like both of our jaws just dropped.
Falls in the bathroom. That's like
the coffee hasn't kicked in quite yet. Sorry, everybody. No, the cost of a fall in the bathroom, which is around $30,000. Like,
yes.
Wow.
Yes. So if they
and you know how much a tub transfer bitch costs? $100
or less.
Or less. But I'm just saying,
yes.
I'm giving us a good healthy budget. $100, and insurance will not pay for that. However, they will pay for your $30,000 hip fracture and fix and hospital stay. Just saying. If any payers are listening, I'm just saying, I'm trying to save you money, guys.
Yeah, it doesn't make it make sense. But yeah, I mean, you talk about literally like any bathroom modification, even if you were to go like full blown, like we're going to gut this bathroom, we're going to put in a barrier-free shower and grab bars and a handheld shower head and all the works, like shower tub bench, that would cost less than one fall in the bathroom.
Yes.
At home. It is wild. It is wild to me.
Yeah. That is actually, it is so, the way that we prioritize things in healthcare is so frustrating. And I think here's the thing. If you're listening to this and you are not a healthcare provider, because we have lots of listeners who are health providers. We have lots of listeners who are family caregivers, not healthcare providers at all. Here's something that I want you to know. that is that your healthcare provider is just as frustrated as you are with how things work. We don't want it to be like this either, because I think we all realize none of this makes any sense. Crazy pants.
Yeah, it definitely doesn't make any sense. And yeah, Brandy, like to your point, like health plans should pay for it. You should pay, they should opt to pay for the $100 tub transfer bench. They, and especially like I don't know. I could go on and on and on about it, and I won't take everyone like let's go on this crazy, path with Maria. But yeah, it definitely, this is something that it's like, yes, this makes so much more sense to save everyone's money to be able to pay for like simple home modifications and things to keep people safe at home.
And I am going to go down this crazy path just a little bit
okay.
longer.
I was just going to say, this is why you're here. So yes, let's
yeah,
go down this path.
let's go. So one of the things that we've talked about on Care Lab before is like, and Brandy talks about this a lot, the reasons why Medicare or other insurers won't pay for this type of equipment, right? And that is, and like jump in and correct me here, Brandy, if you need to, but basically the idea is that if that equipment can benefit someone else in the household or isn't like tied to a direct like medical condition, then they basically are like, nah, we're not going to pay for this. But here's the thing. There's lots of holes in that logic. But here's one of the holes in the logic. I've never met anyone who saw a tub transfer bench and was like, damn, that's sexy. I need one of those.
You're 1,000% right. Like my mother-in-law broke her ankle a couple years ago, and she is very much into aesthetics, right? Like her bathroom looks a certain way. And just knowing that was the only way for her to say, like, she couldn't put weight on one foot because she had to let her ankle heal. And for her, like, to go like, that's my choice. That's this white plastic, flimsy feeling tub transfer bench is the only option I have right now to actually get a shower so I can feel like a human being. Like yes. So to your point, Amelia, yeah, no one is like, ooh, yes, I better get one of those just because like I'm getting it for free or whatever. Like no one's abusing plastic white tub transfer benches.
No.
That's true.
And they are great.
But also, yes, and we should be making it cool and make it fit the space. And that's why I gave us a healthy budget of $100, because there are nicer ones, and there are ones that are built in and flip down, and there's lots of things, there's lots of options, but you just don't know that. And also, if you don't plan for that, you might not be able to enact that because you fell and broke your ankle and you didn't know that was going to happen. Do you know what I mean? You might not have the time to order said thing, get said thing installed, and have it match your decor. But if you think about it in advance and you plan for it, then you can make it look beautiful. Like to me, that should be part of our motivation for planning ahead, because humans don't like to plan ahead and we like to procrastinate. This is the same reason why insurance doesn't really even want to pay for this kind of stuff, because our system is set up to cover things that have happened, not to prevent things from happening. And so we can easily say, sure, if you fall, it costs this much, and if you didn't, you could just spend this much. But what if nobody fell? They're kind of like leaning on that hope. Like, well, the $30,000 doesn't have to be spent if nobody falls. And that's like denial, but it's also partially true because not everybody does fall. So it's not a one-to-one correlation. And so you've got to be intentional about taking the effort to do a few things, not only to prevent a fall, but also to have the things in place that you would want to have, that you can love, that you can like how it looks. And those things do exist.
Yes. And I agree. Oh, no, Amelia, you go ahead.
I was just going to say, and planning ahead for like having those things already there doesn't mean that you're planning to have an issue, right? It doesn't mean you're planning to get sick or be injured. It means you're planning to stay healthy, actually.
Yes. That is the easiest way to keep making sure that your needs are taken care of no matter what comes your way. And the thing too with Brandy, you're right. Not everyone falls. Not everyone needs a wheelchair. Not everyone has a lot of like chronic health conditions. The thing though that healthcare companies or health plans or long-term care insurance, what they're seeing now is that even though not everyone has a fall or is really sick, they are still paying unsustainable amounts of money for people to receive healthcare services. And they look at it as if like, okay, like for Medicaid programs in each state where they're like, we are spending, thousands, like this huge part of our budget on personal caregivers to go into people's homes because those people aren't able to go to the bathroom by themselves and like pull up their pants and wipe their bottoms, and they're not able to shower themselves. And so they're looking at this like, this is a huge problem because we are getting more people who are living longer in a healthcare system that doesn't focus on prevention and keeping people as healthy long-term as possible. So, and for life insurance companies as well, you're, through any employer nowadays, I've never worked for a company, like we grew up in this time where we never worked for companies where we could buy these like life insurance policies, like through an employer where we would gain benefits or we would have those benefits after leaving that job. But for the people who did have it, who are now becoming older adults with more needs, those are companies that are finding out like, oh no, if everyone uses their long-term care benefit, like we're going to be out of business. So those are the people who are now thinking like, oh shoot, we do need to invest in some kind of prevention because in the long term, like we're not going to have enough money to serve everybody and fulfill the promises that we had made initially.
That we sold. And this is also the reason why, even though that policy was kind of sold to that person when they were in working age as like, hey, if you can't live at home, we'll pay for your nursing care. Those policies have changed to say, we will also pay for in-home caregivers or home modifications because it's far cheaper to do that at home than it is to go to a skilled or assisted living, which they will be, on the hook for paying for because they did pay for their long-term care insurance. So, okay, I'm going to pause us. Amelia, we can hear you dragging your coffee cup on the table.
I'm so sorry. How bad was it?
At the first time, we were all kind of talking and bantering, so I heard it, but I don't think it messed anything up. But like right then, it was like, so. And I was the one talking, so I was like, okay, this time I can pause and tell her we can hear your cup.
Okay, all right. I've moved the cup. Sorry, guys. Sorry.
That's okay.
You weren't even thinking about it. You're just like fidgeting with it, I figured.
I'm just, I wasn't even aware that I was doing it.
I heard it, but the mom brain like canceled it out because I'm like, that's not what I'm focusing on. So way to go, Brandy.
Okay. This has nothing to do with anything we're talking about, but do you both of you have an uncanny ability to cancel out noise?
Yes.
And I don't mean actually I have a really low sensory threshold for like music. I can't work when there's like music or other people talking or things like that. But if there's like beeping or alarms or my phone ringing or like any of the things that if my husband ever leaves me, it will be because I did not respond to a text. Because I just don't. That's public on the record. If he ever leaves me, that's why.
That's what it was.
That's what it was. But like, I can just block all that stuff out. Can you block all of that out? Is it the same for you or no?
Okay, I'm gonna preface that by saying I can filter it, and so I can very quickly recognize what that sound is. Does it require my attention? No, it does not. I'm going to ignore it. But I still hear it. So like there's a din of noise in my house all the time. And I'm always like going on, turning off TVs that people have left on and nobody is watching. Turning down TVs. Like, why is this so loud? Turn this down. Why are you, child, yelling? I'm sitting right here. Like, I can hear you, so like I'm always trying to turn the volume down in the house. But like if a kid is crying, I'm like, that's not a hurt cry. That's a you're mad cry. I'll come deal with you in a little bit. Or maybe you'll get over it before I get there. So or that's a crash I've never heard. Like that's a sound I haven't heard. What is happening? Who's doing that? Like that's what's happening in my brain like very quickly.
Yeah, that's fair. Maria?
It's a similar kind of thing. Like, how urgently do you need me? And, luckily I have one child in the house, so it's not too bad. But sometimes my husband and child will speak at the same time. And I'm like, I can't do both of you. Like,
No.
it has to be a one at a time situation. But yeah, like, if I hear the dog bark or whatever, it's like in the middle of the night, if I hear Saskia waking up, I'll be like, oh, okay, yeah, I need to go up to you right then and there. But yeah, it's kind of like I noticed, like I heard the coffee cup, but I'm like I'm like talking right now, and so I'm just gonna focus on that and not so much. But I forget, like, oh yeah, I guess when you're recording a podcast, maybe you should consider the noises.
Geez, Amelia, maybe you should consider where your coffee cup is while we're recording.
God, get it together. I'm so
Get it together, lady.
I'm right next to a staff door, and they keep like keying in, and I'm like, oh no, or is it detectable? Like, can you guys hear it? So I guess we'll find out.
I can't hear it right now. Okay.
Okay, good.
I'll redirect us back to the topic
Since
at
you
hand.
unredirected us, yes.
That is my role here.
You're
I
like,
introduce chaos and tangential topics into the conversation. You're welcome. Not sure. Depends on the listener's preference. Hey there, it's Amelia. Listen, I am so thrilled to have a great resource like Ask Sammy as part of the Care Lab team, and here's why. It's a game changer for aging in place because it makes it so simple. All you do is ask. Just type in your question or even tell Sammy what the problem is and get tailored solutions. Everything from innovative adaptive equipment to comprehensive resources. It's a great way to become more empowered, to live more independently, and to live with greater confidence. And my favorite thing about how Ask Sammy works is it's deeply rooted in dignity and practicality. So whether you're a fellow therapist, a care partner, or someone who's seeking solutions for themselves, visit www.asksammy.com. We're going to link it in the show notes so you can find it there. Start making home more accessible today. Now, back to the show. I do want to ask you though, Maria, especially since like you're huge focus with Toilet Talk, and if you haven't checked out Toilet Talk or followed Maria, you absolutely should because
Yes.
her content and her education level on this stuff is like bananas. It's out of this world. You absolutely should check that out. Also, her fun, creative aesthetic that we were talking about earlier. What are some of your favorite things to recommend to people for fall prevention in the bathroom?
Oh, my number one, like everyone on the planet needs this, is a grab bar at the shower entry. Just one that's vertical, which means up and down for those of you who can be spatially challenged like me. Yes, just one straight up and down grab bar next to the shower. That is just like the secret sauce I have in my household because there's quite a range of heights. My daughter, she's 5, she's less than 4 feet tall. The grab bar needs to be low enough so that she can comfortably reach it. So she's not like reaching up high for a grab bar, but something that she can grip close to her body. And then my husband's 6 feet tall and I'm in the middle. So we have a longer grab bar to accommodate all of us. And in fact, like when my kiddo, we only have like step-in showers in our house. We don't have like a tub shower or anything, or even just a straight up tub. So ever since she started where she could walk into the shower, she's been holding on to the grab bar, which has been great because I don't know about you, but like my toddler, well, when she was a toddler, she's a little clumsy. They're just like, they're kind of all over the place.
Like
and me as an adult, I'm still the same.
Yeah.
Yeah.
Can I ask you, did she just do that naturally? Was she just like, bam, that's there, I'm going to use it? Did she do that?
I didn't have to tell her.
That's a well-placed, just intuitive grab bar then that everyone is using. I love this.
It's a universal design concept. where it's just, it has that intuitive, like people, they walk into this space and they're like, this is obviously what this is for, like for me to hold on to. And it's, you know, if she uses another shower, she's putting her hand up on the wall or on the shower framing or whatever anyway. Like that's just, it's something. Now for me, like, yeah, I use the grab bar because it's there, but it's just, it kind of depends on the environment. Or if I'm like, oh, that floor looks really slippery, I do want to hold on to something. Or no, I can, you know, I'm at the YMCA, so I'm just going to like walk into the shower and there's not anything for me to step over. Like that's great. But yeah, I would say that is the biggest one that literally anyone can benefit. I'm like, you know, we all get sick. We all, like, if you're at the gym having a hard workout day, like it's nice to have something to hold on to. Like injuries happen. I like, you know, I'll be 40 this year. So I'm like, why is my knee randomly hurting? I don't know. I woke up like what did I do to it? I literally don't know. So having something there just in case is always nice, no matter what.
Maria, you're also dropping gems in here, like just throwing out really key concepts. So I'm going to put an explanatory comment in because you mentioned universal design, which is not just like an understandable term in the sentence that you're saying, but it's actually a thing, right? And so, like, you know, the concept of universal design, for anybody who's never heard of it, is that while we all as OTs might have worked with you specifically because your person had a stroke and we made all these changes in your bathroom that were unique to that person's needs, universal design flips that and says, I don't know who's going to be in this space, and I'm going to create it as accessible as possible for any type of person. And that means whoever comes in there will probably find ease in using it, like the vertical grab bar that's long enough for a kid to reach as well as a 6 foot tall person, right? And so that's the thought process that we should have when we build new things or like make a new house or create a new facility or place, because you don't know who's going to live there, but you do know that that place is probably going to exist for the next 100 years. So why don't we make as easy an access space as possible?
Mm-hmm.
That's like, that was such a beautiful description. Just like, yeah, planning for like, I don't know who's going to be there, but yeah, that's exactly it. And I totally agree. Like all new buildings should have, I know we talked about this before, Brandy, but seriously, I'm going to figure out in Kansas City, like how to make like visitability, like a thing for new building codes, and making sure like there is at least one entryway going into a home that has 0 steps, because not only is that good for people who are, you know, wheelchair users or use a walker, or you're, like I said, you had leg day at the gym and you're sore, but it's also great for caregivers. And just like, you know, we all of us had young children. Like how much easier would it be if we don't have to navigate steps while trying to carry a screaming child inside, and, you know, like bags of stuff and just all those things. Or even like when I was a caregiver for my grandparents, and they used rollators, and like having to help them navigate that mobility device on, they had 2 steps to enter their home, but still like that was like a thing, like getting them in and out of the house. And you know, just having those things in place for people, no matter what their life circumstance is it's just very, very common sense.
It totally is.
Totally. And I want to key in on this other really important word that you've used here, which is like visitability, and talk about a little bit about what that means for folks. So visitability is this
easy to say.
Kind of, it's easy to say, first of all, especially if you're me.
So you should use it all the time.
So you should use it all the time. Visitability is this idea of making sure that all places can be visited by anyone. So it's not just that a home is accessible to that individual person. It's that their friends, their families, members of the communities can also be welcomed into those spaces, which is beneficial for everyone. You know, one of the things that we talk about is that we all talk about as a society is quality of life, right? What does quality of life mean? It doesn't just mean being able to like get up and go into your own bathroom and wipe your own bottom. Quality of life has to do with being around the people that you love, the people that you care for, being out in your community, doing meaningful activities. And this idea of visitability is really, really key to that in creating stronger communities that everyone can thrive in, as opposed to only those folks whose like bodies fit into a certain box of function, right? So I think that visitability is one of my favorite. It's not really new, but it's probably in like the last 5 to 10 years that we're really starting to talk about this more. And it's this concept that I really hope continues to grow in terms of both people's understanding of it and really embracing this idea that when we build for everyone, we all benefit from that.
We all benefit. That's totally true. And that I take that one step further, because I feel like what's happening in the media or news or in healthcare is to talk about how challenging for mental and our physical bodies is for social isolation for older adults, right? Yes. And there's all this research coming out that talks about how social isolation is a significant barrier to health and a social determinant of health. And so we need to be doing all these things to make sure that the older adults in our lives are not isolated. Well, if you could barely handle getting in and out of your own house, how likely are you to go visit your kid? How likely are you to go to see your friend or go back to church? Because the barriers that exist there. You got stairs, you got whatever. I don't know how far it is to the bathroom. When I get to the bathroom, can I get up from the toilet? And all of that is too much to be embarrassed about. And so guess what? We stay home. And then when we stay home, we don't move as much. We get more depressed. We don't see as many people. And so it's completely connected, right? And so the problem I think we have in our society is that we silo things so much in order to become experts to do well at them, which is understandable. But then when we get that silo, we forget about the rest of the picture. And so we're now caring about social isolation. We should also be caring about visitability, because that's a key reason why people are self-selecting to isolate.
Mm-hmm. Oh, yeah. Oh, gosh. That just reminds me so much of my grandparents. Like, my grandparents were Catholic. They used to go to church every Sunday. My grandmother was heavily involved with church activities. She used to sing in the choir. So as she got older, she stopped singing in the choir because there was this 800 stairs and this narrow ass staircase to go, they're rickety, no handrail, to go up and down to sing in the choir. And so she stopped because she could no longer access and go up there. And so, so just not going, they relied on watching church on TV, which is great. Technology, wonderful, brought church services into the home. But again, she was less active. And her being less active, when she went out in public, she was also incredibly embarrassed of her incontinence. Mm-hmm. And it was difficult for her to use other bathroom setups because it was hard for her to safely move around, get in and on and off the toilet, dealing with the rollator, navigating in small spaces with that, which sometimes you're not able to because bathrooms are so small, bathroom doors swinging into the bathroom space. So your rollator doesn't fit, those were barriers. And so for her to get out, it was, we need to plan the right time of day. We need to make sure, of course we had backup incontinence products and those kinds of things, but where are we going? Is the bathroom accessible? She would try to hold it the entire time, which when you have urinary incontinence, if you're out for a long period of time, that's not a great idea for your bladder. And it makes you even more incontinent. So there's just a lot of things stacked up where it's just I live in a family of healthcare providers. And that was my grandmother. That was her existence in a family of healthcare providers who, on the surface, you would think oh, she's sad, nothing to worry about. But no, even with that level of support, she still was not able to get out as frequently as she liked. And so she did have that level of social isolation.
Mm-hmm. Care Lab listeners, it's Brandy, and as the founder of a platform made to make aging in place easier for everyone, I knew it would be incomplete if we did not have education, especially for caregivers. So whether you're a family caregiver or somebody who trains a whole organization, Higher Standards caregiver training videos are for you. I'm so proud that we were able to partner together with Amelia in order to provide these to you because they're easy for everybody. You get great occupational therapist-led training on topics like transfers and how to care for someone as they age, or maybe as things change when you have Parkinson's. So no matter if you're the loved one who doesn't know exactly what to do next because things are getting different, or if you're a professional who trains caregivers that go into the community and you need some quality education, you get both from Higher Standards Caregiver Training. And you need to check them out at higherstandardscaregivertraining.com.
Because you can have all the knowledge in the world, but if you don't have an environment that is set up to support putting that knowledge into practice, it doesn't matter.
Yes.
And I think, like, I thank you so much for sharing that story, Maria, because I think it keys into the fact every single person who is listening to this or watching this has a story like that. Mm-hmm. They have a loved one who has been through this. Maybe they've been through this. These aren't like, nebulous kind of what if examples. These are real world things that we know happen to people, and they have an impact on individuals. They have an impact on families, and they have an impact on us all, whether we want to think it does or not. Mm-hmm. If you could care less about someone's ability to go out and have a higher quality of life, I bet you still care about how much it's going to cost you in the long run. And that does come back to cost all of us, right? Because when we don't support strong communities and strong social networks and strong social support systems, we spend more on healthcare because there's more debilities, there's more falls. We have to put more money into spending on care providers, right? Like, because there's not the social support system to step in there and help us all work as communities together the way that we're actually supposed to. Yeah. Like, we're not supposed to live all by ourselves as humans.
Exactly.
We're pack creatures, folks. Yep. We need each other. So if you don't care about anything else, and I actually think most people do care very deeply about the quality of life of the people around them, but we have to think about this in this bigger way. So that was such a great example, Maria.
I'm really glad. Yeah, that I'm sure I have zero doubts that people listening to that can connect with I'm seeing that in my family now. I see that in my parents or grandparents or whatever, or that happened to my neighbor. And so, just thinking about, I couldn't help but think the introverts or people who are well, I don't want to get out in the community, or I don't want to, which is fine. That's great. But when we all need to go see the doctor at some point in time. We all no one is immune from going to the grocery store or the library, where I'm at, or, places where you would want and like to go, even traveling, if you had to travel somewhere. All of these places need to be accessible so that everyone can easily get in and out. And I just can't help but remember, my parents used to live in this house where they had a lot of steps. Any way to get into the house, they had a lot of steps. And so that was something where my grandmother, she came to a point where she's I can't come over for Christmas because I'm too scared to go up and down your stairs. Even if you come and help me and, physically, it's too much. And so, but I have a lot of hope that because the conversation is getting, bigger about visitability and accessibility. I know in the country right now, there's a lot of issues with diversity, equity, and inclusion. And just, we're getting these voices from the federal government that are these programs are not important. But I'm starting to see a huge backlash. And I know as an occupational therapist, I am part of that backlash to say no, these are things that must stay in place because these, everyone deserves to belong in these public spaces. Everyone deserves to get healthcare and education and, on and on and on, all of the resources that we need. And so this is a part this community accessibility, but even home visibility, Visitability. See, easy for me to say too. Like all of that. Yeah, just like, let's all continue to advocate for it, because with an aging population, it just doesn't make any sense to try to go back the other way and say, oh, no, we like having things accessible as they are, and we love excluding others. No, that's ridiculous to me.
I think I'm going to piggyback on that a little bit more, and 100% with you, Maria, that like we should support diversity, equity, and inclusion programs, and those should be supported by the top levels of everywhere, because when we are diverse and when we are inclusive, we're so much stronger than when we're not. I also want to say that no matter what the government tells us, we can choose to embrace diversity. We can choose to embrace inclusion. We can choose to embrace equity in our own endeavors in whatever we do. And like, that's an important part of how we support those things every day as well, and how we kind of push back against some of these ideas that maybe that being diverse, being equitable, and being inclusive is somehow harmful to us. It's not. It helps us all. We're all stronger when we're together. I think that's a really American value, actually.
Yeah.
And we, I think, as individuals, can just continue in our own decisions to make sure that we're supporting, making sure that that's still important to everyone.
Yeah, absolutely. I mean, as healthcare providers, in OT programs, like you can't graduate from an OT program and sit and take the boards unless you have DEI education as part of your program and part of your like training. So it's just like this backlash is unreal to me, because it's like these are patient populations who are serving, and we, as a profession, we advocate for them, and we try to make environments, like all kinds of environments, but specifically I'm talking about the physical environment, conducive for everyone. So yeah, it's something like I'm very proud of our profession as occupational therapists, and I've been feeling really good about, participating at the state level and like AOTA level, and everyone has the same stance that these are things that we need to keep in place to protect our children, adults, older adults, like all across the lifespan.
I think this is a great example of how to talk about diversity, because frankly, when we say diversity, equity, inclusion, what a lot of people think about is race only. And so while that's the most visible thing, because not everybody's disability or thing is viewable, we're also now acting on that, trying to keep people out of doing things because of their race. But I want you to think about, like, is it better or worse for your life if your sister with MS is just as easily able to get to the movie theater as you are? Is it better or worse for your life that your grandma is able to end up on the plane and go on a trip with you because the thing has been made accessible, and we've thought about that through and through, right? That's inclusion. That's the definition of inclusion, right? And that's also, and like both having the same level of ability to travel around the city or the country or wherever you're going is equity. And so to say that this is unimportant and also puts people in jobs that they don't qualify for, no, what it does actually is put everybody on a more even playing field, because we haven't been on an even playing field, whether it's because you look a certain way and I can see that and I can exclude you, or whether I don't see you around because the environment doesn't support your ability to do your everyday functions and be here. And so we need to think of it in the more broad sense that it actually is, and recognize what the level of impact that is going to be on our society. So I think I'm proud about being an OT, because our whole profession is set up to be that, right? Because our goal is to try to help you be as safe and as independent as possible doing whatever it is you want to do. And we're queens of adapting, right? And so that's no different in any of these situations.
Yeah, well put. One of the like core values of being an occupational therapist is the idea of occupational justice, right? And if that doesn't align, then I don't know what does.
Yeah.
Yeah, kind of like then how and why are you an occupational therapy practitioner? But yeah, and just all of healthcare. And I wish that DEI wasn't so politicized right now at the moment. It doesn't make any sense to me. I mean, even
because
the
it's
racial
actually
part.
not. It's actually not a political issue. Like, you're right, it
not.
has been politicized, but it's actually not a political issue.
Yeah, I think that's like what's super frustrating right now. But it's I think the more we keep talking about it and giving people the opportunity to really think like, oh yeah, this DEI isn't just about race, even though it's like, I don't know why we're honing in on that specific component. I think it's important for us to recognize and celebrate each other's differences, and knowing like there's way more things that bring us together than not. And it's just like, as healthcare providers, we're like, we see all the ways that people are different, where we have that diversity. Like you said, Brandy, like not everyone's disability is visible. Like you could see somebody, for people who are neurodivergent, for instance, or just like there's all kinds of ways that make people different. And just helping people be able to participate, like you said, all at the same level, being able to have the opportunity to experience the world just like anybody else could. I don't understand what the issue is with that. And that's okay. Like, I don't have to understand. All I have to do is just keep focusing on the small things, which is having these important conversations, being active, knowing what's coming up politically, and just being there to help be a voice of reason and support that like DEI needs to remain in place, and we should continue to focus on expanding it. And what does that look like? What do we want our communities to look like?
And you want a smaller talent pool or a bigger talent pool?
Facts.
Yes.
If I'm hiring, I want a bigger talent pool. If I'm looking, towards like the kids that are coming up in the world right now and who are going to be taking care of us in not all that long, because time flies, folks.
Listen.
Like, bigger talent pool. Let's draw on all of the amazing talent that's out there and not exclude it because it doesn't fit into a certain like box or mold that we think it ought to.
Yeah.
Because who knows? Who knows what's around the corner for any of us? What if someday we don't necessarily fit into that box or mold?
Yeah.
That's why it's so important, like, thinking about just taking care of everyone.
Yep.
We could go on forever and ever and ever.
Those are also facts.
Because it's the three of us and we just can't stop when we get together. And we should probably have Maria back on again very soon to keep talking about bathroom stuff, because we didn't even cover.
We didn't talk about it.
It's like, haha, gotcha.
You thought we were talking about this, but then we talked about auditory distraction and DEI. So
DEI.
there you go.
I have no idea what we're going to title this episode, because we were just like all over. We talked about all the things. Talk about all the things with Maria Lindberg on Care Lab. That's what it's going to be.
That's the title. There, done and dusted. I do want to say real fast, because Maria, you didn't get a good introduction because we just jumped right in because we know each other so
I'm
well.
like, everyone knows me. No, I'm kidding.
Yeah, if you don't know Maria Lindberg is an occupational therapist who helps people make beautiful and safe bathrooms by providing candid toileting tips and bathroom solutions at toilettalk.me. You can follow her on all kinds of social media, and you definitely should.
Yes.
And if you have made it to the end of this episode, then bless you. And please make sure that you subscribe and download some more episodes. And please leave some comments. We would love to know about what you want to hear about on Care Lab. Maybe something that you want Maria to come back and talk about specifically. That would be super fun. And we'll try to stay on topic. We'll
try very hard. No promises. Yeah.
Nope. We'll try. No promises. Until next time, though, we'll see you right back here on Care Lab.
Bye, everybody.
Thank you and goodbye.